Are there any non-surgical treatment for eye bags? You have tried everything. You've tried lots of under eye cream, home remedies, but those eye bags just don't seem to go away. To talk about this, I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center for Aesthetic Health. So let us start by understanding what are eye bags. Obviously, it's in the name. There are bags underneath your eyes. But why do these eye bags happen? Well, here let us understand the anatomy. You can see in this photo, there are two kinds of fat in the area under the eye. One is called orbital fat, that is just below your eyeball. One is the cheek fat. Now, as we get older, two different things kind of happen. This orbital fat, which is normally inside your eye socket, it starts coming out. And because of that, it starts pushing out and forms a bag over there. Along with that, the cheek fat reduces. So you have a bag and then you have a groove below that. So the bag on top is happening because of the orbital fat coming out. The groove below that is happening because of the cheek fat going in. This happens to a lot of people as we get older. But in some cases, it happens anatomically also. It happens in young people also, just because of how the skeleton is. So in some younger people, they have eye bags because the eyelid fat is automatically coming out even at a younger age. So now that we understand what eye bags are, what are the treatments? Are there any non-surgical treatments? There are a variety of treatments. You have non-surgical treatments such as lasers and skin tightening devices. You have mildly surgical treatments which are internal skin tightening treatments. So these are skin tightening treatments that work from inside the eye. And then you have proper eye bag surgery. So which of these works where? In early eye bags, very mild eye bags, the fully non-surgical treatments work. So you can do external tightening, external microneedling, radiofrequency, lasers. These kind of things will help with those faint, just small eye bags. In medium eye bags, which aren't so severe, there you can tighten the eye bags by using the internal tightening treatments. And this is something called Accutite. You can see in this machine here. So this Accutite treatment, what it does is we make a tiny hole and there's like a needle that goes below the skin and it heats the skin from inside. And this stimulates the skin to shrink and tighten. So this works for medium eye bags. But when you have severe eye bags, like you see in this photo here, there is no non-surgical treatment that is going to work. Simply because the eye bag is so huge, there is so much extra skin, there is so much fat that is coming out that there is nothing non-surgical that can work on this and it is just a waste of money. However, you can camouflage them using something called fillers. So what we do in that case is when someone doesn't want surgery or they have a function to go to, they don't have time to recover from a surgery, then we camouflage these eye bags by putting some filler into the groove below the eye bag. So fillers can't take away the eye bags themselves, but they can hide them by hiding the groove below and thereby making them less prominent. You can see an example of that here. In this patient, we have not actually done surgery to remove the eye bags, but we have used filler to mask the eye bags. And that finally brings us to eye bag surgery called blepharoplasty. This is the best treatment for severe eye bags and it is long lasting. So what do we do in this surgery? Like I said, there are two issues here. One is there is extra orbital fat that is coming out and second, the cheek fat that has gone in. So for the extra orbital fat that is coming out, we go from inside the eyelid, we go from the pink part of the eyelid, we make a cut in the pink part of the eyelid and we remove that extra fat that is coming out. At the same time, we might remove a little bit of skin also if there's a lot of loose skin. Along with this, we do some fat grafting. We take some fat from your stomach and we put that into the groove below the eye bag. So the extra orbital fat that is coming out is reduced. The cheek fat which has reduced is replaced. So what has come out has taken back in, what had gone in is brought back out. And that gives us a smooth lid cheek junction where you don't have that eye bag appearance anymore. Now this surgery, it's a daycare procedure. You come, get it done, go home the same day. There's no admission or anything. Your eyes are going to be noticeably swollen for around a week or so. For like a week or so, people can make out that you have done something. Typically after a week, no one can make out whether you have done anything. At the same time, we can fix other issues in your eyes. We can improve the appearance of your upper eyelids if required. We can tighten the eyelids if required. All of these are part of the surgery. Now, are there any risks to this procedure? Does it affect our vision? Short answer is, this is not an eyeball surgery. Your vision will not be affected in any way. This is an eyelid skin surgery. So that is the first thing to understand. There will be some swelling after the surgery, as I told you, for a week people can make out. there can be some bruising. Bruising is like a reddish mark in the under eye area. Some people hardly bruise, some people bruise a lot. If a bruise happens, it will go away, but it might take a couple of weeks to fully go away. So now let us see some results of this blepharoplasty surgery. So, I want to tell you that blepharoplasty is one of my favorite surgeries to do. It is what I call a low risk, high reward surgery. It is not a very big procedure, it's a daycare procedure, but it can cause a dramatic improvement in your appearance. As you have seen in our patients so far, all of these patients, they looked young elsewhere. The lower part of their face was young, they hardly had any wrinkles on their forehead, but they had bad eye bags, which make them look very tired. And this simple surgery takes at least 5 to 10 years off their life. So, if you think you're a good candidate for this procedure, reach out to us. I hope you found this video informative. Don't spend your money on treatments that are not going to work. Remember, if a monkey has only one hammer, everything looks like a nail. Someone who does all the treatments from non-surgical to surgical is in the best position to guide you on what is the best treatment for your particular needs. Thank you. Have a great day.